Welcome to Dare, the show for innovators, entrepreneurs, and startup leaders who dare to shape the future. Your hosts today are Ned Hayes and Cecilia Mariani. Dare is brought to you by Darwaf, the superpower tech team that can make your vision a reality. The Dare podcast is excited to welcome Rob Cohen to the show today. He's the CEO of Livara Health, a musculoskeletal management company. And the company is really focused around improving outcomes and lowering costs for people. And he's been a CEO for several other healthcare companies, including Bamboo Health. He's also held leading roles at Healthways and Wellpoint. So welcome to the show today, Rob.
Thanks, Ned. I appreciate you having me.
So first, tell us about your company. What do you do there?
Sure. We're a value-based musculoskeletal management company, as you referenced before. We work with primarily risk-bearing providers and payers, employers a little bit as well. And we really work with them to help care for their patients experiencing musculoskeletal issues in a very holistic, multidisciplinary way, so that we improve patient experience, we improve outcomes, we reduce provider burden, and we ultimately lower healthcare costs as well. Musculoskeletal spend is about $400 billion per year in this country. When we analyze populations, it's typically the number 2 leading category in terms of spend in a population, and it's growing very, very fast. And to sort of make matters worse, not only is it extremely expensive, but patient experience is really poor, with some studies indicating that as many as 50% of patients are unhappy with their outcomes and their journey. And so we're really here to improve all of that.
Really? I had no idea the spend was that high. So just for our audience who is mostly technical and on the business side, first, let's back up and explain what is musculoskeletal.
Sure. Musculoskeletal refers to another way to think about it as sort of orthopedic.
Okay.
So conditions involving joints, bones, et cetera, ligaments, anything like that. Things you might go to PT for, you might go to an orthopedic surgeon for, or a physiatrist or a pain specialist, all of those sorts of issues, all the way from the acute, could be fractures, to the chronic, arthritis, right? Conditions like that.
Right. So if I twist my ankle or my back gets out of whack or even I break my arm, all of those are covered under this category. Is that accurate?
Correct.
Okay. Got it. So how do you do things different at your company?
Sure. So think of us as both as assistants for the providers throughout the system, as well as the patient, as care navigators, as care coordinators, and as providing some care ourselves. We think about what we do in 3 main categories. It's care planning, it's care navigation, and it's care delivery. So we will partner with providers or payers. We will either identify ourselves or receive referrals of patients that are experiencing musculoskeletal issues. And we will first assess them and risk stratify them, is how we would put it, in terms of trying to understand the severity of what the patient may be dealing with, and then a likely path that is the best path for the patient. And so we first do those assessments both digitally, but also by connecting folks to an orthopedic surgeon that works for us, or a PM&R doc, physical medicine and rehabilitation, or a PT. They will assess, they will then sort of make decisions about that patient. We have a full virtual and digital program we can put them through if we believe they're appropriate for that, or that those interventions are appropriate for the patient. Those are things like digital physical therapy, hybrid physical therapy, so digital combined with in-person, as well as a set of psychosocial interventions, which we find to be really, really important. So think depression, anxiety, mindfulness, nutrition, sleep. All of these things are really, really important when you're thinking about a patient experiencing musculoskeletal issues.
That's really fascinating to me because a lot of people on this show are startup people, entrepreneurs, people who are grinding hard. And we've talked a bit about on this show about mental health and about, frankly, getting enough sleep and proper nutrition because that fuels your engine. That keeps you going. And it keeps you going to accomplish more in business. But what you're saying is it also has a an observable effect on your actual, bones and muscles. Is that what you're saying?
Absolutely. For some people more than others, but I think, we may all know people, for example, who, when they're experiencing particular stress or in a time of particular stress or anxiety, their back hurts.
Hmm.
And then when that time passes, their back sort of gets better. And
Interesting.
so, for certain people, there is definitely a large interaction between mind and body. And then there's some very clear elements of nutrition, for example. So certain foods cause inflammation and certain foods are anti-inflammatory. And the same around alcohol use, right? Drinking alcohol is particularly inflammatory. And so we can educate people and counsel people about how to make certain lifestyle changes that, when combined with some of those physical interventions, if you will, can have a big impact.
Wow, that's really interesting. So it's just interesting how often we think, especially if we work in the digital realm, we think everything is happening, on a device or it's happening, in some sort of cloud ether. But really, most of what will affect us and affect our decision making, affect our business acumen, that all comes down to what your body is doing and how you're treating your body, right?
Absolutely, both, right? And how you treat your body affects how your body is doing,
Mhm.
obviously. And I think the promise of some digital interventions is, can they help people change their behavior in certain
Yeah.
ways, right? Behavior change is very, very difficult for individuals, right? They eat differently, exercise more. We all know the right things to do, but it doesn't mean that we do them, right? And so, can certain, apps or devices, help remind you, help gamify, help do various things that'll help you change that behavior that then has a positive impact.
Yeah. Can you speak further about any digital interventions that you've seen? Part of the reason I'm asking is that the sponsoring company for this podcast actually does a lot of work with healthcare companies, especially building out digital apps, building out systems to monitor patient health. So I'm curious if any of the kind of work that Darwaf does might be helpful.
Sure, we could really think across the board. The most basic things that you see very widely in use today are exercise tracking devices. You have a smartwatch, if you wear a Fitbit, if you wear any number of other devices that are tracking steps or strain or whatever else is happening with people. And if that's impacting your movement, then we all know that has positive impact on people across the board in terms of the healthcare spectrum, whether it be diabetes or back pain or anything else they're dealing with. So there's certainly an
Right.
example. And then, to the extent, as I referenced, certain apps are gamified, right? Gamification became such a big thing a number of years ago and continues to be. And so it's amazing how people's behavior can be driven by the desire to earn the next badge, right? Or the next points. And so there's another big opportunity. And then, if you want to think specifically about musculoskeletal, one thing that we've seen really make its way into a lot of programs over the last, couple of years are things like computer vision integrated into a digital physical therapy
Mm.
experience. So it's the machine is actually watching you and tracking your movements and can give you real time feedback on if you're moving your arm at the correct angle or bending at the correct angle. And like I said, can give you real time feedback on how to change if you're not. And those obviously are both beneficial because it ensures you're doing your exercises correctly, but they can also be particularly engaging. So quite a few things that continue to come along that hopefully, continue to have an impact on people's activity levels and everything else.
Right, right. Well, speaking of kind of going for the next achievement, you've had quite a trajectory yourself. I mean, you came out of working in areas not related to health, and then you migrated into actually leading a healthcare company. So, can you tell us a little bit about your journey all the way from McKinsey to running a healthcare company today?
Sure, sure. Yeah, as you mentioned, I didn't do any healthcare work at McKinsey and then spent some time in some other roles that had no connection to healthcare and really got into healthcare very much happenstance. I was in business school and a former partner of mine in a company that we founded together gave me a call, and he had been engaged by Wellpoint, now Anthem and Wellpoint and Elevance, and they were doing some innovation work, and they had engaged him to do some consulting. And he reached out to me to help with that project while I was in school. And so we created sort of an innovation roadmap and a new concept for them. And they asked us to go build it as I was coming out of school. And so that was my journey into healthcare. As often happens in careers, not planned at all. But once I got into healthcare, really saw the vast opportunities for improvement. Really the struggle that patients had at certain times throughout the healthcare journey, and really fell in love with just the opportunity to continue to have an impact.
Yeah, healthcare has a distinctive impact on the world in a way that is different from other businesses. Can you speak a little bit further to the kind of impacts that you see, those kind of positive impacts on people?
Sure. Well, so many areas of healthcare that one can work in that end up being very mission driven. And yes, they may be venture backed or they may be private equity backed, or sure, there's a profit component to it. They are businesses,
Mhm.
but it doesn't change the fact that they're very mission driven and that ultimately the interests align. And I've been fortunate to be on sort of the forefront of certain innovations along those lines. So the first being consumer directed healthcare, which
Mhm.
was the first thing I built, and then I got into value based care really right before the Affordable Care Act came out, and then have continued to kind of build my career in value based care and absolutely love it. And when you think about lowering costs, for example, which is one of our goals in our programs, that is not purely a financial or economic concern. To
Mhm.
the extent that there is waste in the healthcare system, to the extent that there are unnecessary procedures, unnecessary spend, that is spend that is can be crippling for other areas of the healthcare ecosystem where that money could be spent.
Mhm.
And it can obviously also have poor impact on patients and others. And so, lowering spend is both beneficial for the payer or the risk bearing provider who you may be working with or the employer, but it also is beneficial for the entire ecosystem and therefore for patients. And that's really where it comes down to. As long as you keep the patient at the center and always the focus of what you're designing and what you're doing, then you can be pretty confident that what you're doing is doing well for them.
Right. It goes back to business fundamentals of actually deliver a product that people want, right? That if you stay in touch with your consumer, in your case, your patient, they will tell you what's making a difference.
That's exactly right. That's exactly right. And that can be seen in a variety of ways. Obviously, we track outcomes through claims data or other clinical data. We track outcomes through patient reported outcomes. So is your
Mhm.
pain getting better? Is your function getting better? And then we track outcomes through NPS scores, for example. Are
Mhm.
you are you having a positive experience in our program? And our NPS scores are 94. And so patients absolutely love our program because we offer convenience, access. We fill a lot of gaps that they otherwise feel in the healthcare system, and help them get better.
Right, right. So I know there have been a number of changes in the US, especially the US healthcare system over the last, 10 to 15 years, where Obamacare came out. I know Biden passed various changes to make healthcare more accessible as well. What changes have you seen during your tenure at Bamboo Health or now where you're at that have changed health for the better for people?
I really do believe it's the sort of creation, if you will, of value based care through the Affordable Care Act and the continued evolution of that. It wasn't completely created. There were institutions that were already acting in that manner. Folks like UPMC, Kaiser, really organizations up and down the coast, the West Coast in California. But outside of those, the healthcare world was still living in very much of a fee for service or operating in a very much a fee for service manner. And obviously, as has been talked about ad nauseum, the incentives are completely misaligned in that system. And so value based care is about aligning incentives for patients and providers and everyone involved to, as I said, to really improve those outcomes, which leads to lower costs. And we haven't seen the progress maybe that, we would like in terms
Yeah.
of the pace, but CMS and CMMI, Center for Medicaid and Medicare Services, and the Innovation Center continue to be very dedicated to coming out with new models and ensuring that they drive adoption. And so it really is, about turning the healthcare system into a preventive and proactive system, not a reactive system, right?
Mm-hmm.
And ensuring that providers can get paid when they keep people healthy, not once they treat people once they're sick. And it's so obvious to say it, but it's not certainly not the way it operated in the past. And it's actually pretty difficult to execute. And so the good news is we continue to innovate. We continue to see better and better outcomes. And that's what's exciting. And that's what's exciting about coming to work every day.
Right. Fantastic. Well, thank you so much for sharing that perspective with us. So we do have one last question we'd like to wrap up with, which is what do you dare to dream? What future do you see yourself creating?
Sure. I think, all of us have experienced the healthcare system in some way, whether it's ourselves as patients or helping our parents.
Mm-hmm.
And we all know it can be frustrating. Patients can feel lost. Family members can feel lost. And that, by the way, is through no effort. There's a lot of good, hard work happening in the provider world and in health systems, but it's just the way the system is. And so really, the dream is, can we see a day when patients don't feel that way, when family members don't feel that way? They feel well cared for. They feel like their providers are communicating with each other. Everyone knows what's happening. They don't feel like things might get missed. They don't struggle to understand what medication am I supposed to be taking, because one doctor said this, but then the hospital said this. And we know that there's just so many areas. And so if we can really achieve a system where patients feel like it's all well coordinated and they feel really safe and secure, then I think we can assume that the rest of the pieces have fallen in place and that everything else is happening as it should be happening. Outcomes have improved. The cost curve has been bent, all of those sorts of things. And so that's what it's really about. And it'll always be about a combination of technology and people. Technology will never take over every function of healthcare, obviously. And so it's about marrying those in the right ways closely in order to achieve that and scale that. And that's what we're out to now.
Got it. Well, it does remind me, I wanted to ask you a question that didn't really fit into our earlier conversation, but now it fits in based on what you had just said. There's a lot of hype around AI and around, using large data sets in order to analyze fresh data, what they call large language models, what they're calling AI. I'm curious if that has some impact on the future that you just described. Like, are there ways of using AI in order to make healthcare better?
Absolutely. And it's in a variety of ways. I'll talk about just a few of them. One is through our work, for example, we spend a lot of time refining and innovating in our analytics to predict patients that we believe are on the path to becoming high utilizers of musculoskeletal issues, or they are of care, or they are on the way to having issues in musculoskeletal care. And the more that AI and machine learning advance, those predictions can become more accurate, and we can focus more on the right patients at the right time. We also focus a lot on identifying the providers we should be sending them to. So when we navigate people to community care, who are the providers with the best outcomes? And who are the providers that appropriately using the right sites of service, right? Ambulatory surgery centers when they should be used, inpatient surgery when it should be used. So on that analytics side, there's a big opportunity in AI. And then really on what I would say the patient-facing side and the way AI can help scale clinicians. And so the more that we are able to communicate with patients, check in with patients, see how they're doing, understand how they're doing, trigger the right events based on what they're reporting, the better. And it's very challenging to do that by actually having a human reach out as much as you might like them to. But to the extent that a large language model can create a very intelligent chatbot that can have a conversation with a patient via text or your app or whatever it may be, and actually, drive that understanding. And then at the right time, right, then it can really understand, okay, now I need to connect that patient to my physician, via video or whatever. There's a huge opportunity there. And I think, we're getting there obviously very, very quickly. Everyone has seen the way ChatGPT and other things have really advanced much faster than we could have imagined. And so that day is not far off. And it's already here in some ways.
Yeah. Absolutely.
Yeah.
That's really fascinating. Thanks for sharing your perspective on that as well, Rob. Thanks for the conversation today.
Absolutely. Thank you for having me.
Thanks to our guests today for their great insights on DARE, the podcast for innovators, entrepreneurs, and startup leaders. If you'd like your story to be featured on DARE, just contact us at info@darwaft.com. DARE is brought to you by Darwaft, the tech team that can make your vision a reality.